With that, Dr. Polsky. Unfortunately, we have to have Dr. Polsky back. No disrespect to Dr. Polsky, but there's some things going on, and we're back to our weekly updates.
No one wishes I didn't have to be here more than me. No disrespect to any of you. Clicker is not.
It's got COVID.
There it goes. It's got
Some quarantine.
Quarantine. Batteries work.
All right. So when we last left each other, which was a few weeks ago, our case count was down. Then it jumped dramatically 2 weeks ago. Actually, the cases tripled in 1 week. Went from 34 cases up to 101. Keep in mind that we count cases from Thursday to the following Wednesday, so we avoid any reporting problems over the weekend. So the data up there is through this previous Wednesday. We'll get new stats in 2 days. There was a slight decline last week, but don't get too excited because over the past week, there's been a 55% increase in cases across the state of Maryland. And I looked at our still forming numbers for the week right now. It looks like we're on pace probably for 120 cases or maybe a little bit more this week. When you take a look at the numbers of positives, negatives, you see that the testing is going up a little bit each week, and the positives, again, that big jump the last full week of July, and then a little bit of a decrease down this previous week. When you look at age ranges, the 15 to 19-year-olds continue to be our biggest concern. Right now, the last 2 weeks, the positivity rates, that's the percentage of positive cases per every 100 tests done, and the threshold for worrisome is 5%. The positivity rate in 15 to 19-year-olds over the last 2 weeks has been 13%. And the concerns both in keeping kids in school, and that goes both in high schools and in our local community college. A little bit of good news, we have seen the number of students over this past week, high school students getting vaccinated double from the week prior. So we're hoping that trend will continue. When you look at statewide numbers, the last time that I pulled up slides, I do these from scratch every week. I kind of plug in new numbers. I either had the numbers from late June or early July. There were 519 cases. I only had to change one number. Unfortunately, it was inserting an entire new number in. So we've had a statewide a 10-fold increase in cases since late June, early July. I put these numbers together yesterday. So current hospitalizations across the state were 400 yesterday. This morning it's up to 424. It's a 6% increase in 1 day. And keeping in mind that from the time someone gets infected, it's generally about another 10 days to sometimes 2 weeks before they end up in the hospital. And if they're going to die, another week after that. So the expectation, unfortunately, is that hospitalizations and deaths will continue to increase. Hard to say how much, but will increase over this coming month. Also, I'm sorry, I meant to mention that locally, to the best of my knowledge from the sources I get, there are 6 Calvert County residents currently hospitalized, 3 in intensive care units, 2 locally, 1 outside of Calvert, and 3 people on regular med-surg wards or hospital wards. As you can see from the numbers, about 20% of people across the state who are hospitalized right now are in intensive care units.
Do you know the age of those individuals?
There is one person in their 70s. The others are not seniors. They are younger. And I will say all of them are unvaccinated. Like not one, like completely unvaccinated. I'm not sure that, at least since Delta has really come on the scene, that we've had any vaccinated Calvert County residents, to the best of my knowledge, that have been hospitalized. So turning to Delta, much as I went over last time, keeping in mind that we know that the variant is much more contagious than previous strains of COVID that we've seen. Onset of illness is much quicker than with the previous strains. And that one dose, if someone just got one dose of Pfizer Moderna, which we still have about 4,200 people in Calvert County who have only gotten one dose and are more than 28 days later and have not gone back for their second, that those people have very limited protection. They really should get their second dose, even if it's been 3 or 4 months ago from their first dose. All they need is the one second dose. They don't need to start all over.
Doc, I thought they had to do that in a time frame. I thought initially, wasn't there this big push that it had to be in a certain time frame?
Well, it's certainly ideal, because if I get my first dose and then I get my second dose 3 or 4 weeks later, I have full protection at that point. If I wait 2, 3, 4 months, I'm going relatively unprotected for 2, 3, 4 months. If I happen to get exposed to COVID during that time, I'm much more susceptible to getting very sick. So there's no purpose to waiting, but if you wait 3 or 4 months, the boost in immunity is just as good as if you had gotten the second dose 3 or 4 weeks later, as opposed to 3 or 4 months later. And these numbers have changed slightly since the last time we talked, but not a whole lot. That there's still 26,000 Calvert residents who are eligible for vaccination who remain completely unvaccinated. And then we have 13,000 children under age 12 who can't be vaccinated. So we still have roughly 40,000 completely unvaccinated people in Calvert County, with the additional 4,000 who are partially vaccinated.
That's what, almost about 50%?
Close. So 55% of our county is fully vaccinated. And I probably should have included a separate slide on breakthrough cases. So I just want to mention that on our health department website, which is calverthealth.org, or on our Facebook page or Twitter, I wrote up as brief as I could. It's a little bit longer than my usual post, but I wrote up an explanation for why we're seeing more breakthrough cases with Delta. I think it's hopefully pretty readable for people and may give them a much better understanding of where we stand and why, even though we're seeing some breakthroughs, the vaccine still is, for the most part, really accomplishing the goals we want, which is to minimize any serious illness and still significantly decrease the risk of infection. So what we're seeing since Delta really started up, that's when we started looking at breakthrough cases. And what we've seen is that for people who are vaccinated, they're 5 times less likely to get infected than people who are unvaccinated. And then, again, we have not seen to this point any hospitalizations. We know it can occur, but the risk of being hospitalized if that person should get COVID is much, much lower, almost negligible compared to the unvaccinated people. And then this slide just shows, because we were very stagnant for a while with vaccinations. We'd seen dropping and then just kind of plateauing. And this slide reads in ascending fashion. So 4 weeks ago, there were about 530 people in Calvert who received their first dose, their first vaccine. And we've seen a slight and gradual increase. So this past week, 872. We're hoping and we know that, again, a disproportionate percentage of those are high school and to some degree middle school students. So we're hoping to see that continue to accelerate as we go through the next week or two. As far as our general rankings, so the top half of the slide is unchanged from before. We're still second highest out of the 24 jurisdictions in the state as far as vaccinations for seniors. About, I think it's 92.7% have received at least a first dose. Close to 90% have been fully vaccinated. We're still 7th among adolescents, teens, and 11th, which puts us actually below the median. So across the state, at least for a first dose, it's 60% of the population. We're about 57.5%, with a little bit less than that fully vaccinated.
Doc, have you noticed now, and maybe I'm completely wrong, it seems like, though, that stat that we're at unvaccinated kind of reflects what the country is.
Well, in some respects, across the country, it's worse. But like in Maryland, you're seeing significant differences in different parts of the country. So you have Vermont, where over 80% of the eligible population, are fully vaccinated. That includes 12 and up, not just adults. And then we've seen what's happening in a lot of southern states where vaccination rates are sitting around 30%. And so I don't want to call out certain counties, but there are a few counties on the sort of the edges of Maryland where vaccination rates are sitting in the 30-some%, and then you have Montgomery and Howard County where you're sitting at 80% for their county.
Well,
So
I think it's been made a political issue, which it should have never have been. And let's be honest, the mistrust in government is valid, right? Government's never been wrong, or government's never been deceptive. So I think, when you see a lot of these numbers, it's people going, I don't trust government, and it's come away from a medical issue because politicians have made this a political issue. You can't find one to get on TV that doesn't talk about COVID. When, what does a guy who say he was whatever walk of life and he wins an elected office, what does he know about medicine? I mean, to be quite honest, that's not what they do. It's not a dig at them. It's not what they do. But, when I see these numbers and you talk about, and the demographics you talk about red and blue states. And it's been made political, and it ought to, if somebody doesn't know something, they ought to just say, hey, you know what, we just don't know. But this is what we think. This is what research has told us. What are we, a year and a half into this thing? Let's be honest. What can you really know in a year and a half that we knew about? How many years have we had polio vaccines on the books? 60, 70, whatever it has been? We actually have a lot more information about that than we do this. And so, and obviously this is, not what you do, but, where we've put all this focus into this, it ought to be getting the trust back from people that we're big enough to say if we don't know something, to just say we just don't know.
So I couldn't agree more that health should never be politicized.
Should never be.
Not naive enough to think that it isn't and won't continue to be.
Well, we're of the same age. You remember AIDS. AIDS was a political issue back then. They were not testing the blood supply. How arrogant could it be at the time not to test the blood supply? But politics got in the way. There was scientists saying you have to test the blood supply.
And
so
I would just mention two things. One, as the head of our county's health department, I feel it is an extraordinarily important responsibility of mine and my staff to make sure that people have access to the best scientific evidence out there. That we don't care anybody's politics. We are, as far as I'm concerned, I have a physician responsibility to every resident and everyone who works in this county. And so when we do post things on our website, it is the best, most current information that we can provide. And I can't stop people from making whatever comments on Facebook.
Well, it's when they turn on network news,
people
and
should be assured.
They watch the debates back and forth. It has turned into such a political issue, and it really shouldn't be. Politicians really should not be in the middle of it. But you see, everyone cannot pass up a microphone without grabbing that. And I think when you see that, I think that's the root of most non-vaccinations is a mistrust of government.
Well, and then to the second point is that over and over, because I can't force anyone to trust me, I can't force anyone to trust our health department or government writ large. So over and over, I encourage people, if they have concerns, they have questions, to speak to their physician, their nurse practitioner. That I'm going to do the best I can to inform them, but I don't know all the specifics about their particular health. And for most people, I don't have a personal trust relationship with them, that I'm not expecting everyone to trust everything I said. It would be nice, but I don't expect that. So, but it concerns me as a physician that people are denying themselves what could be literally life-saving treatment by listening too much to what shows up on the web, shows up on cable news. And they owe it to themselves, they owe it to their families to make sure that they're basing their decisions on the best information they can for their health. And that really comes from their personal health care provider. I do have to point out that I forgot to change the stats on the bottom of the slide, so those are from previous. If they don't match up exactly with another slide, the stuff at the bottom half is a little bit outdated, although it's not off by much. And then I just put up, in case anyone who is viewing at home or for the benefit of, for our elected officials, that the current numbers as of yesterday for 12 to 17-year-old vaccinations, as I mentioned, we were 7th highest in the state. For 18 and over, and then for 65 plus.
So in the future,
Yeah.
for that chart, can you kind of highlight Calvert across the graph? Because you start reading across, it
Yeah,
starts to...
I can try. The problem with this is a PDF that the state gives out, and so I can't manipulate.
Oh, well, then
the
that's
way-
all you got to say. It was a low bid.
I will see. I'll see if I can figure out a way to, kind of play with things a little bit. Sometimes I can overlay things, but yeah, there's a limit.
Even
But-
if you put them out of
well,
order, if you can, and put
yeah.
Calvert first.
Maybe
that
what
at
I'll do
least-
is I'll try to get a box around, rectangle around there, and then
Yeah.
decrease the transparency enough that maybe you can see through it.
Yeah, when you start following across, you kind of start
Yeah, I hear you.
doing that.
Okay.
wig-wag.
Yeah, I will do my best.
All right.
And then, so Commissioner Hart, to your point, at the very bottom, call your nurse practitioner or doctor.
And I think that's
to
great
arrange-
stuff because people should go to their doctor. Turn off TV and talk to their doctor.
Yeah.
And the doctor may say, hey, in my opinion, knowing your medical history, being your doctor, look, this is good for you, it's bad for you, whatever it is. But that's the advice that should be taken. Mike Hart telling somebody to do something is a joke, okay? Because what do I know about medicine?
Even
You
Chris
know.
is laughing at that.
I mean, it's the truth, though. What politician knows anything about medicine, about fixing a road, about anything? You win a popularity contest, and all of a sudden it's this godlike syndrome, and you turn. I can't even watch TV anymore. You're trying to watch a regular show, could be watching a tennis match, and some politician pops on, I'm fighting for your rights. And this, oh man, shut up. I mean, it's gone so ridiculous. The credibility of the profession has got to be at an all-time low. So, sorry.
Any other questions?
Doctor, I do have a couple.
Yeah.
If a person has been previously infected with COVID, they came out the backside, everything is great, they have the ability of having antibodies, I understand, correct?
Correct.
Natural antibodies. Is there a way that those can effectively be tested to determine if they have that quote-unquote natural immunity without the vaccine? And if so, how's that done?
So if people read the latest posts that I put on our website and on social media, so one of the things that addresses is that particular issue. What we've seen, because Delta is different enough from the previous strains, that our natural immunity doesn't always recognize it well enough. And the other is that the level, so everyone produces antibodies unless your immune system has certain rare problems. But otherwise, everyone produces antibodies in response to an infection. Those natural antibodies will diminish over time. They diminish more quickly over time than when people develop antibodies in response to vaccination. So the amount of protection and the duration of that protection is not as good. What studies have clearly shown is that when people get vaccinated after their infection, that their circulating antibody levels will jump up 5 to 10-fold. So just an enormous increase, and they will have longer sustain. So with this variant, and we have better studies out of the UK because the Delta variant arrived there and really took hold about 2 months before the US. It did clearly see an increase in the number of people who had been previously infected with what they used to call the UK strain or the Alpha strain, and then got sick again with the Delta in ways that they weren't seeing with the previous variants. So the short answer is it's still very worthwhile to get vaccinated because you just don't know for any one individual how well those antibodies are going to sustain. And what you can measure is not going to quantify that well enough to tell you how protected you are.
All right. And one other question, and going back to the testing, if a person does have either the vaccine or they've been infected before, whatever, and the antibodies kill this is something I heard the other day, and I just wanted to get your professional opinion on it. If they go in to have a test done and the test picks up dead virus cells that have already been killed by the body, is that possible that can show up as a positive test?
So we're talking
And that
two
did
different
not come from YouTube University, by the way.
So wait a minute.
YouTube University.
I just want to
That's
clarify.
pretty
So we're
good.
talking two different things. So now you're not talking about antibodies. You're talking about if somebody gets tested for COVID.
Yes, sir.
So if somebody gets a PCR test, the PCR test looks for fragments of the genetic material of the virus. as long as there's any genetic material remaining in the body, then it will still show a positive. So we've known from back, March of last year, that some people will continue to test positive by PCR for weeks, maybe a month or two after their infection is over. But that's not anything that's sort of new news.
So it will pick up dead virus as a positive test is.
Yeah, so it's actually the genetic material. It's not the whole virus, but yeah. So if let's say that I got infected today, and then I got tested 4 or 5 days from now, I'll test positive, and then if I get tested 2 weeks from now, there's a chance I'll test negative because all of those remnants may have cleared, or I may continue to test positive, and I may test positive a bit later. So there's no way to completely distinguish. You won't still test positive, say, 6 months down the road.
Gotcha.
But up to about a month, it's still a possibility.
Thank you.
So, Dr. Polsky, in one of our conversations recently, I just want to make sure I thought I heard what I heard. We talked about cleaning surfaces. And I did hear it again on TV the other night that this Delta strain, surfaces really don't impact transmission. It's all about aerosol, contact. So, because there was a story on TV the other day, people said, don't fill your car with gas because, the gas pump can transfer the virus. And I heard one of the schools talking about, don't worry, we're going to clean every single desk every single day. But I thought in our conversation, cleaning is not as important of an issue today as we thought maybe before, or it's because of the Delta virus
So I
strain?
just want to nuance this just a little bit. You're absolutely right that the vast majority of transmission is respiratory. Either droplets come out, somebody directly breathes them in, or aerosol starts to accumulate. It is possible to pick up COVID from a surface, but generally I would be concerned more about daycare settings where you have little kids who are like, and that material stays kind of moist for a while, and then other kids are like all over the place, and you're putting your hands to your face all the time. In those kind of situations, yeah, there's definitely potential to pick up the virus. Most situations that we're going to deal with on a day-to-day, that's going to be a low potential, but there are other viruses certainly that can make us sick that tend to last longer on surfaces, and we're more likely to get infected. So I think it's still good, just general health measures to be mindful, but not to be obsessive.
Correct. Make sure you wash your hands, but as far as cleaning surfaces, we don't have to
Well,
steam this room today when we're done.
so when I see patients on the hard surfaces on the chairs, I'll have a little antiseptic wipe, and afterwards I'll just do a quick wipe. I don't, the whole room, just the chair handles, and that's it.
Good. Thank you.
Okay.
I think we're good.
That's a great.
Thank you.
Great, all right, thank you very much.
Absolutely.
Thank
Thank you,
you.
Doc.
Have a good day.